General adult tests, your heart and circulation. Your heart and blood vessels, arteries, veins, and capillaries form the transport network that carries blood to every cell in your body, supplying the cells with oxygen, nutrients, and other vital chemicals, and removing wastes. The heart beats continually to pump blood through the blood vessels. Muscles and valves in the blood vessels also keep the blood moving freely. The heart is divided vertically into two halves. Each half consists of an upper chamber or atrium that receives blood from the veins and a lower chamber ventricle that pumps blood into the arteries. One-way valves present backflow of blood. Located in the chest behind the breastbone, the heart is a fist-sized, hollow muscular organ that pumps about 60 to 70 times a minute when you are at rest to ensure a continual flow of fresh blood to all parts of the body. Its right-sided chambers receive oxygen-depleted blood from the body and pump it to the lungs to be oxygenated. The oxygenated blood returns to the left-sided chambers where it is pumped around the body, eventually returning to the right side of the heart to repeat the cycle. Laid end to end, your blood vessels would stretch 60,000 miles or 97,000 kilometers. Problems with your heart and circulation are potentially serious, as they could lead to conditions such as heart attack or a stroke. Basic checks of cardiovascular health include measuring your blood pressure and your heart rate and rhythm. More sophisticated checks include electrocardiography or ECG and ultrasound imaging such as echocardiography and scanning for an aortic aneurysm. Arteries have thick muscular walls to withstand the high pressure of blood pumped from the heart. Arteries can dilate or constrict to help regulate blood pressure. Veins have relatively thin, stretchy walls so that they can cope with any increases in blood flow. Large veins contain one-way valves to prevent backflow of blood. Capillaries are the smallest blood vessels. They have walls only one cell thick to allow oxygen, nutrients, and wastes to pass into and out of the blood easily. Thank you for your attention.
Let's discuss interviewing craving. Desire means excessive craving. This includes this inclusion of this as a cause of disease reflects the Buddhist influence on the Chinese medicine, which began during the Tang Dynasty. The ultimate cause of disease, according to the Buddhist thought, is desire, that is clinging to external objects or other people and always wanting more. This excessive craving, which is one aspect of the emotion of joy in Chinese medicine, causes the minister fire to blaze upward and harass the mind. This is meant as a constant craving which is never satisfied. This can include craving for material objects or recognition. Craving affects the heart and scatters qi. Craving also affects the pericardium by stirring the ministerial fire. In disease, minister fire refers to a pathological empty fire arising from the kidneys. It affects the pericardium and therefore the mind. If the mind is calm, settled, and content, the pericardium follows its direction, and there is a happy and balanced life. The mind is weak and dissatisfied, the pericardium follows the demands of the craving, and the person constantly desires new objects or new marks of recognition, which, however, even when attained, are never satisfying and leave the person more frustrated. It is for this reason that Taoism, Confucianism, or Buddhism puts the emphasis on reducing craving to prevent the arousal of minister fire, which steers the mind. Craving will cause heart fire or heart empty heat depending on the underlying condition of the person. If there is a tendency to yin deficiency, which is a common in people who tend to overwork, it will lead to heart empty heat. This will cause palpitation, molar flush, a dry throat, insomnia, and mental restlessness. For the summary, craving, it affects the heart and pericardium, scatters chi, akin to joy. Thank you for your attention.
Let's continue our discussion on foot yang ming, or in the stomach meridian, stomach 5, the great welcome. The foot yang ming stomach meridian, stomach 5, is found on the anterior to the angle of the mandible in the depression anterior to the masseter attachment, as seen here in the illustration. Stomach 5, or great welcome, great reception, and also called marrow hole. The point is partly named for its location. The lower jawbone is sometimes called the great reception bone. Stomach 5 is used for the spirit of earth when the person has lost the flexibility necessary to accommodate others and is unable to receive life's bounty. For our life to take on form and potential, we have to be able to transform the influxes of heaven and the earth, where we live within us in our center. If we cannot welcome the process, the transformation will never occur. Welcome also appears in the name of stomach 9. People welcome. When earth is in good health, we are confident, more capable of acting from our center, more able to include others and nurture others appropriately, just as the earth supports us. When earth feels threatened, it can close up, become rigid, and suspicious of what others may demand of it. This point helps the individual be open-minded about what life may offer. From stomach 5, a branch of the meridian travels down the throat to stomach 12. Stomach 5's proximity to the lower jawbone and its pathway down to the throat where we receive nourishment means the stomach 5 may help us to swallow information. May be used locally for toothache, pain in the jaw, or frequent yawning. Indications: helps the mind and spirit when suspicious of life or anxious about receiving anything new. Sometimes used as a spirit point when a person is closed off and unable to receive nourishment, information, or what life may be offering them. Consider for pain in the jaw, frequent yawning, or trigeminal neuralgia. Its location on the lateral mandible anterior to the masseter muscle. How to find this? By asking the patient to clench their teeth. The anterior border of the masseter muscle becomes clearly palpable. Stomach 5 is located directly anterior to the border of the muscle in a shallow depression on the mandible and slightly above the angle of the jaw. Here, the facial artery can be palpated. Needling would be 0.3 to 0.5 tune obliquely or transversely subcutaneously in the direction of stomach 6. Caution for the facial artery vein. Actions and indications to expel wind and opens the channels. Special features would be the meeting point with the gallbladder channel according to some authors. Thank you for your attention.
Let's discuss kidney patterns, kidney chi deficiency. Concept: this is due to kidney chi deficiency and abnormal function of sealing and storing. Clinical manifestations: there is soreness and weakness of the lumbar region and knees, mental fatigue, lassitude, tinnitus, deafness, clear frequent urination, dribbling after urination, enuresis, involuntary voiding of urine, nocturia, abnormal large or frequent urination at night, urinary incontinence, nocturnal emission without dreams, or spermatoria, and premature ejaculation in males, metorrhagia, profuse clear leukorrhea, stirring of the fetus, fetal distress in women, pale tongue with white coating, a weak pulse. Key symptoms is symptoms are related to dysfunction in storing of kidney and bladder. For the analysis of kidney chi deficiency, when there is kidney chi deficiency and abnormal function of storage, abnormal function of bladder chi, there is frequent urination with clear urine, dribbling after urination, nocturia, enuresis, urinary incontinence. For the insufficiency preventing essence storage, nocturnal emissions, premature ejaculation, dysfunction of daima, clear and diluted leukorrhea, dysfunction of Chongmai and Renmai metorrhagia, deficiency of fetal chi, steering of the fetus, fetal distress. Kidney chi deficiency, there is soreness and weakness of the back and knees, tinnitus, deafness, mental fatigue, lassitude, pale tongue with white coating, a weak pulse. For the summary, kidney chi deficiency, etiology, emotional strain, fear, shock, anxiety, excessive sexual activity, chronic illness, old age, overwork, underlying accompanying pathology, heart chi deficiency, liver chi deficiency, spleen chi deficiency, Eben chi deficient. Signs and symptoms: diminished hearing, dizziness, tinnitus, backache, weak back, weak bone, weak knees, lack of strength, deafness, heel pain, loose teeth, hair loss, premature ejaculation, vaginal discharge, flooding, spotting, frequent urination, urination at night. Pulse, there is peak on right rear position. Tongue slight pale. Treatment principle is to supplement kidney chi. For the acupuncture treatment, we use bladder 23, which supplements the kidney. Ren 4 supplements kidney essence. Ren 6 supplements the original chi. Stomach 36 supplements stomach and spleen chi. Do 4 supplements kidney yang. Kidney 6 supplements kidney yin. Kidney 7 benefits the kidneys. Kidney 3 nourishes yin to root yang. Needle with supplementation. For dizziness, do 20, do 16, GB 39. For deafness, Sanjiao 17, GB 2, SI 19. For sore and back and weak back, do 3, bladder 40, GB 34. For vaginal discharge, GB 26, bladder 30, spleen 6. Relevant advice: men should avoid ejaculating and women should avoid becoming pregnant. The patient should avoid lifting heavy objects and working too hard or placing a physical strain on the body. They should eat a diet that strengthens kidney yang. Thank you for your attention.
Let's continue our discussion on palpation, the chest and flanks. The apex of the heart. There is best palpated below the left breast, between the fourth and fifth rib, where the apex of the heart beats against the chest wall. It is connected to the large collateral of the stomach meridian and is where thoracic chi gathers. Thus, palpation of the heart apex can produce information on the ampleness of the thoracic chi, the strength or deficiency nature of the illness, and the prognosis. In normal conditions, the pulsation of the apex is rhythmical, forceful, and unhurried. If its pulsation is feeble or not palpable, then thoracic chi is deficient internally. If its pulsation is excessively forceful, then thoracic chi is leaking outward. If the beating is too fast, then there is accumulated heat in the chest and abdomen, with stronger evil chi or yang chi is depleted with outward escape of weakened yang chi. If the beating is too slow, the illness is one of cold or of deficiency. If there is no beating at all, then thoracic chi is completely exhausted and death is either imminent or has already come. Note that the apex of the heart may not be palpable in very obese patients who are otherwise normal. The breast. When examining the breast, pay attention to the texture and elasticity of the tissues and whether there are lumps or tenderness. A normal breast gives a sense of elasticity and feels like fine, soft, and irregular grains. There is no pain from moderate pressure. A red and swollen breast with pain that is aggravated by pressure signifies a breast abscess. If the center of the swelling is soft and fluctuant, then there's already pus formation. Breast abscesses are mostly caused by blockage of the milk duct, depression of liver chi with stomach heat, or chi stagnation and blood stasis. If the breast contains one or several masses that are the size of plums with in distinct borders and matting to surrounding tissues, and that in latter stages may rupture and drain pus. It is mammary tuberculosis. Its main causes are blazing fire, immune deficiency with gelling of phlegm and fire. If the breast has egg-shaped masses that range in size from cherries to plums or eggs, with smooth surfaces and hard body, and that are movable and well demarcated, this is due to phlegm and static blood collecting in the breast and forming benign tumors. If there is a mass that is very hard, has uneven surfaces, is not movable, or is poorly demarcated from surrounding tissues, this is mostly likely breast cancer. There may be more than one mass in breast cancer. Palpating the flanks. Discomfort or pain on pressure accompanied by a dry throat or a bitter mouth and loss of appetite signifies illness in the Shaoyang meridian. If the right epigastrium is full and tender and is feverish, there is likely to be a liver abscess. If the mass in the right epigastrium has an uneven surface, it signifies liver cancer. Tender masses below the armpits, whether soft or hard, are mostly due to chi stagnation and blood stasis. Thank you for your attention.
Let's discuss liver fire invading the lung. The liver is anatomically immediately below the lung. This means that if there is liver fire, the fire can rise upwards and invade the lung. This will create heat in the lung and interfere with the lung's descending of qi. In this pattern, there will be symptoms and signs of liver fire, as well as symptoms and signs indicating that the functioning of the lung is disturbed. Foods and beverages that have a hot energy can also create liver fire, including alcohol, fried foods, too much red meat, especially lamb, and spices such as chili and pepper. Chronic emotional imbalances can create liver qi stagnation, which is often a root cause of liver fire. Blood heat can also be an underlying cause because the liver is a reservoir for blood, and the heat from the blood can cause the liver itself to become hot. Symptoms and signs: shortness of breath or difficulty breathing, chest oppression, hypochondriac tension, cough with yellowish or bloody sputum, constipation, bitter taste in the mouth, throbbing headache, dizziness, red eyes, anger, irritability, intense, slightly staring eyes, appears to be stiff or slightly distended in the chest region, spurs, dark urine, red face, quick body movements, burning, urination, thirst, red tongue with even redder sides and red front, dry yellowish tongue coating, rapid and wiry pulse. Key symptoms are cough with yellow sputum, dyspnea, hypochondriac tension, headache, rapid and wiry pulse. Treatment principle: drain liver fire, regulate lung qi. Acupuncture points: choose from liver 2, 14, Ren 17, 22, lung 5, 7, pericardium 6, and LI 11. Needle technique: draining. Liver 2 drains liver fire. Liver 14 and pericardium 6 spread liver qi and regulate qi in the chest. Ren 17 and 22 regulate qi in the upper jaw. Lung 5 drains heat from the lung and regulates lung qi. Lung 7 regulates lung qi. LI 11 drains heat. Because liver fire is the root cause of this imbalance, the person must avoid consuming substances that create heat in the liver. In particular, alcohol, hot spices, fried food, and too much red meat should be avoided. Stress and pent-up emotions, especially anger and frustration, create heat in the liver. A person with liver fire should therefore try to resolve these issues, or if this is not possible, try and reach an acceptance of the situation. Physical exercise is recommended because it will help spread and disperse stagnant liver qi, which is often involved in the creation of liver fire. Liver fire invading the lung can be caused by liver fire, liver qi stagnation heat, and can result in lung phlegm heat, lung yin deficiency, blood stagnation, heart fire. To summarize, etiology for liver fire insulting the lung includes repressed anger and frustration, excessive consumption of hot and greasy foods. Underlying accompanying pathology: liver qi stagnation, lung qi Deficiency, spleen qi deficiency. Signs and symptoms, breathlessness, asthma, fullness, stuffiness, scorching pain of chest, and hypochondrium, cough, yellow or blood-tinged scant sticky sputum, rashness, impatience, headache, dizziness, red face, thirst, bitter taste, scant dark urine, constipation, pulse, wiry, slippery, rapid, tongue, red, redder on sides, dry yellow fur, swollen in lung area. Treatment principle, clear heat and drain fire, moisten lung and transform phlegm. Acupuncture treatment, bladder 13, regulates lung qi. Lung 10, this inhibits the throat. Liver 2, clears liver fire. GB 34, soothes vessels. Liver 3, courses the liver. LI 11, clears heat. Liver 14, harmonizes liver qi in the chest. REN 17, descends lung qi. REN 22, descends lung qi. Pericardium 6, opens chest, descends lung qi. Lung 7 also descends lung qi. Needle with drainage. Thank you for your attention. Excretions and secretions. We discuss the vomitus and sputum. Excretions and secretions include vomitus, sputum, saliva, spittle, nasal discharge, feces, urine, menses, vaginal discharge, tears, sweat, and pus. Vomiting is induced by the retrograde upward flow of stomach qi. Observation of the color, character, and amount of the vomitus helps to understand the cause of the retrograde flow of stomach qi. If the vomitus is thin and without any foul smell, the vomiting is due to a yin illness. There are two common causes: deficiency of spleen yang and stomach yang. An exogenous cold directly attacking the middle jaw, causing dysfunction of the stomach and retrograde flow of stomach qi. Vomiting of turbid and malodorous vomitus is mostly due to heat in the spleen and the stomach, or liver fire injuring the stomach and causing stomach qi to ascend abnormally. Vomiting of undigested food is mostly due to food retention or chronic insufficiency of the spleen and the stomach. This causes inability to digest food, hence its retention and the retrograde rise of stomach qi. Vomiting of clear water, saliva, and sputum is mostly due to accumulation of phlegm or rheum. Vomiting of yellow, green, and bitter fluid is mostly due to dampness, heat in the liver and gallbladder, or accumulation of fire heat. Vomiting of fresh or dark purple blood with clots, with food dregs, is mostly due to heat in the stomach, liver fire attacking the stomach, or blood stasis in the interior. Vomiting of mixed blood and pus is mostly due to gastritis. Sputum is the turbid and viscous matter expectorated from the airway. When observing sputum, pay attention to its color, quantity, and character. Yellow and thick sputum accompanied by agitation, a dry mouth, and a yellow and greasy tongue coating indicates an illness of heat and phlegm. It mostly results from strong fire heat, scorching fluids internally. Clear and watery sputum accompanied by cold aversion, cold limbs, and a white tongue with white coating indicates an illness of cold. It mostly results from exogenous cold or disturbed transportation of water and dampness due to chronic yang deficiency. The retained water and dampness collect and thicken into sputum. Copious sputum that is easily expectorated and accompanied by chest tightness indicates an illness of dampness. Dampness accumulates in the interior, either because of attack by exogenous dampness or because of impaired transportation by the spleen. It then collects and thickens into sputum. If the sputum is scanty, difficult to expectorate, and accompanied by dry nose and dry mouth, it indicates an illness of dryness phlegm. The fluids thicken into sputum either because of attack by exogenous dryness or because of internal damage. Bright red streaks of blood in sputum indicate an illness of heat damaging the lung meridian. Sputum that is purulent, bloody, and foul-smelling, or sputum that is thick like rice gruel indicates a lung abscess. This is due to heat accumulating in the lung and causing suppuration. Thank you for your attention.
Now let's talk about the erectile dysfunction, the muscle, the penetrating vessel, and penis 2. Chapter 44 of the simple questions mentions the ancestral muscle in another passage. The bright yang is the seat of the 5 yin and 6 yang organs. It irrigates the ancestral muscle which runs to the pubic bone and up the spine in the back. This statement is interesting because it is the only one where the ancestral muscle is described as running not only up to the abdomen from the pubic bone to the xiphoid process, but also up to the back along the spine. From this passage, therefore, it sounds like the ancestral muscle is not only the rectus abdominis muscle, but also the spinal muscles or erector spinae. The penetrating vessel is related to the state of the ancestral muscle of the abdomen. If the penetrating vessel is not flourishing, the ancestral muscle is slack. A slackness of the ancestral muscle may cause prolapse of the uterus in women and some types of leg atrophy. If we look at the anatomy of the rectus abdominis muscle, we see that its origin is at the xiphoid process and anterior ribs, and its insertion is at the pubic bone just above the root of the penis. Thus, it is easy to see how the ancestral muscle, Zongjin, can well be both the rectus abdominis and the penis. As we have seen above, chapter 44 of the simple questions clearly equates the ancestral muscle with the penis when it says, when one engages in excessive sexual activity, the penis, Zongjin, ancestral muscle, will become slack, causing impotence, Jinwei, and seminal emissions. If we take the ancestral muscle, Zongjin, to mean the penis, then the penetrating vessel influences the penis, and in particular, the corpus spongiosum and corpus cavernosum, As erection depends on the corpus cavernosum being filled with blood, the penetrating vessel, being the sea of blood and influencing the ancestral muscle, plays a role in erection and therefore erectile dysfunction, impotence, or priapism. Clinical note. The points to use for ED from a disharmony of the penetrating vessel are spleen 4, Gongsun, on the left, and pericardium 6, nave 1 on the right, together with kidney 13, Keishui, kidney 11, Hengu, and Ren 4, Guanyuan. For the summary, the ancestral muscle and the penetrating vessel. The term Zongjin, literally ancestral muscle, refers either to the rectus abdominis muscle or to the penis. The penetrating vessel is related to the state of the ancestral muscle of the abdomen. If the penetrating vessel is not flourishing, the ancestral muscle is slack. A slackness of the ancestral muscle may cause prolapse of the uterus in women and some types of leg atrophy. The penetrating vessel influences the penis, and in particular, the corpus spongiosum and corpus cavernosum, and therefore erection. Thank you for your attention.